This is the thyroid gland. Yes, that well-known butterfly-shaped gland found in the neck region. Although comparatively tiny, it controls many vital processes in our body, like metabolism, cardiovascular function, and even growth and development. But did you know that an estimated 12% of the population have some form of thyroid disease? Or that women are 5 to 8 times more likely to develop a thyroid disorder than men? Or that thyroid disease, if left untreated, can put patients at risk of developing cardiovascular disease, infertility, osteoporosis, and more? Sounds like some important things to be aware of, huh? So if you want to learn more about this little yet mighty control centre of the body, stay with us while we explore the thyroid and the parathyroid glands. Before we jump into the details, here's a quick overview of what we'll cover today. We'll begin by looking at the gross anatomy of the thyroid gland, including its lobes. Then we'll identify the parathyroid glands and where they are. Next, we'll look at the cartilaginous and ligamentous structures of the larynx and trachea, upon which the thyroid and parathyroid glands are found. We'll then move into the vascular supply and innervation of the glands. And finally, we'll explore some clinical notes to wrap up. Are you ready? Let's get to it. First of all, what is the thyroid gland? The thyroid gland is an organ that is part of the endocrine system. Its main function is to regulate metabolism throughout the body by producing the hormones triiodothyronine and thyroxine. It also helps to regulate calcium levels in the blood by producing the hormone calcitonin. The thyroid gland is located in the base of the neck, just anterior and lateral to the trachea and inferior portion of the larynx. It spans from approximately the level of C5 to T1. The thyroid gland is generally butterfly or H-shaped in appearance and is composed of 2 primary lobes, each with a defined superior and inferior pole. These 2 main lobes are simply known as the right lobe and the left lobe of the thyroid gland and are roughly similar in size and shape. Connecting the 2 lobes is a region of the thyroid gland called the isthmus, which we can see from both an anterior and posterior view. In many people, there can be a smaller third lobe, which is only present in about 40% of the population. This is the pyramidal lobe of the thyroid gland and can vary in size and appearance. It is thought to be a remnant of the thyroglossal duct, which is present during development. Functionally, however, it is the same as the other lobes of the thyroid gland. The other glands that feature in this tutorial are the parathyroid glands, which we can now see highlighted in green. In this image, we're looking at the thyroid gland from a posterior view, the left lobe being here, on the left of the screen, and the right lobe being here. Usually there are 4 parathyroid glands in total, 2 on the posterior aspect of each lobe of the thyroid gland. Each parathyroid gland is about the size and shape of a pea at roughly 6 mm long, 3 to 4 mm wide, 1 to 2 mm deep, and weighing on average 50 to 60 milligrams.
This video is not over yet. Continue watching now the full video at kenhub.com. We have lots more videos like this one available to our premium members on our website, not to mention all the fun quizzes, related articles, and atlas sections. So click on the button in the middle to watch the full-length video and master anatomy.